Mastering Basic Epidemiology, Essential Tips for Health Researchers. Welcome to my channel. If you're a health researcher looking to strengthen your epidemiological skills, you're in the right place. Today, we'll cover essential tips that will help you master the basics of epidemiology and apply them effectively in your research. Let's dive in. As a health researcher, mastering epidemiology is critical because it helps you design better studies, interpret data accurately, and provide actionable insights for health policy and practice. Now, let's talk about the foundational study designs in epidemiology that every researcher should know. Each design serves a different purpose, so choosing the right one is key to answering your research question effectively. When selecting your study design, consider your research question, available resources, and the nature of your data. A well-chosen design will make your study more robust and your findings more reliable. To truly master epidemiology, you need to understand the key measures used to describe and compare health outcomes in populations. Let's walk through some of the most important ones. Prevalence. This measure tells you how widespread a condition is at a specific time. It's particularly useful for assessing the burden of chronic diseases. Prevalence equals number of existing cases / total population. Incidence. Incidence tracks new cases of a disease over a specific period of time. It's critical for studying the causes of diseases. Incidence rate equals number of new cases / person time at risk. Relative risk and odds ratio. These measures are used to compare the likelihood of an outcome between two groups. Relative risk is commonly used in cohort studies, while odds ratios are typical in case control studies. Example: if smokers are twice as likely to develop lung cancer as non-smokers, the relative risk is 2. Understanding these measures helps you quantify the impact of health risks and the effectiveness of interventions, giving your research a solid quantitative foundation. Even the most well-designed study can be derailed by common pitfalls. Let's go over a few of them and how you can avoid making these mistakes. Bias. Bias can creep into your study through the way participants are selected or how data is collected. Always aim for random sampling and objective data collection methods to reduce bias. Example: selection bias can occur if your study only includes volunteers who may not represent the general population. Confounding. Confounders are variables that are related to both the exposure and the outcome, potentially skewing your results. Use statistical methods like stratification or multivariate analysis to adjust for confounders. Example: age can be a confounder in a study of exercise and heart disease because older individuals are more likely to have heart disease. Misinterpretation of correlation versus causation. Just because two factors are correlated doesn't mean one causes the other. Epidemiological studies can suggest associations, but proving causation often requires more rigorous evidence. Example: a study may find that ice cream sales and drowning incidents both increase in the summer, but one does not cause the other. Being aware of these challenges and taking steps to address them will help ensure that your research results are valid, reliable, and impactful. Collecting and analyzing data is at the heart of epidemiology. Here are some practical tips to ensure your data collection and analysis go smoothly. Tips for data collection and analysis. Use validated tools. Ensure your data collection instruments, like surveys or lab tests, are validated and reliable. This increases the accuracy and consistency of your data. Ensure sample size is adequate. A small sample size can lead to inaccurate or inconclusive results. Use power calculations to determine the right sample size for your study. Double-check your data. Data cleaning is essential. Look for outliers, missing data, and errors before you start your analysis. This will save you time and trouble later. Choose the right statistical methods. The right statistical methods can make or break your study. Work with a statistician if necessary to ensure your analysis is appropriate for your study design. By following these tips, you'll be well on your way to producing high-quality research that stands up to scrutiny and makes a real difference in public health. Epidemiology is a powerful tool for understanding and improving public health. By mastering the basics, you're equipping yourself with the skills to conduct meaningful research that can change lives. If you enjoyed this video, don't forget to like, share, and subscribe for more tips and guides on health research. Have a question or a topic you want us to cover? Let us know in the comments below. Thanks for watching.